Are you pro the new weight loss drug?
I am.
Yeah.
I am. Yeah. As a cardiologist, I am, because it actually has indications for preventing heart disease and, as well.
It's kind of, my father's is kind of like a miracle drug in a lot of ways.
Amazing.
Like that. And he is upset about it. Not upset. In a, he's not like marching the streets, but he goes to so many medical conferences and is very into like the state of medicine.
Yeah.
And he thinks that I don't want to say anything like wrong, but I'll use his words. He thinks like the Kardashification of the drug in the beginning was detrimental and will cause deaths, because people were so stigmatized to it, and
they might not take it.
That they might not take it. And he's like, literally every second could save a life if they go on this life-saving drug. But people won't do it because they're like, well, then I'll have to tell people, and then then it'll be
there's that element of like people will accuse you of like taking the easy way out or the cheat or whatever, and that's in my head too, because I am considering doing one of these.
I'm gonna take it.
Like semaglutides.
I'm telling you right now, my doctor prescribed it to me. I'm taking it. Because just for what you said.
Thank you for sharing that. Yeah.
Yeah, I mean, it's like, no way would I give up the chance to prevent heart attack and stroke because I'm afraid that someone's going to be like, oh my God, why does he look like, I don't care.
Yeah, I have some follow-ups with my docs in April, and we're supposed to have a discussion about this.
I'm taking it, and as soon as I get my proper dosage and stuff under and everything's like set in stone, I'm talking about it. I'm taking it and I'm talking about it.
It has changed the lives of so many of my patients, and I talk about it regularly, and that's kind of a thing that I offer, tool, a resource, right? I'm like, hey, I'm very empathetic when I'm talking to my patients about weight loss. I'm like, hey, what have you done so far to help? And if you haven't had success, these are the tools and medications that we have that are life-saving, and we can put you on. Would you like to try it? And it's been tremendous. I mean, my patients have lost significant amount of weight. They've actually, reduced their risk factors, right? It affects your lipids, your cholesterol. They've gotten off of blood pressure medications. They've reversed their diabetes.
A1C drops.
A1C drops. I mean, it's incredible.
Here's a question I have for it. Mm-hmm. And this may be we may be talking about something that's not your fortes, because I don't know if the weight loss, like I know it's heart related, but I don't know if it's like this is where the science is. But my fear in taking it is always like, I love food. And I love wine, and I consume it responsibly. For the most, I mean, I still have slip ups, but like, for the most part, and like I don't want to give that. I don't want to give that.
I experience so much joy from it.
I don't want to look at a hamburger and be like, I can't eat that. Like, I'd rather say that because I don't want to, because I'm healthy, but I don't want to lose that love. And I don't know does it do that?
I don't think it does that. I think it makes you feel, basically what the medication does is it makes you feel fuller, faster, and it just suppresses your appetite. It just it works in your brain. There's two areas of the brain that it works, and it kind of suppresses these hunger signals to kind of make you eat less, right? So I think you could still enjoy and don't have to change your diet, but you may feel like you can't eat, the same amount.
Which isn't bad.
No, you can still have a burger. Maybe not. Don't finish it. Maybe you don't.
Well, I mean, my problem. It's like you still have a burger. Like I went to Hamburger America, when I sit down at Hamburger America, that's 2 burgers and a sandwich.
Wait, 2 people have recommended this to me. Dan Greger emailed me about this.
I give it to him.
You gave it to me and him. That's what I'm saying. So then he gave it to you. Where is this place?
It's right next to Aunt's Son.
Okay, I gotta go see the store.
You have to.
I gotta go.
No, you just go say hello and then be like, well, I gotta run, and then go to the burger spot.
Fuck yeah.
It is, I'm telling you, it's like, have you had one?
No.
This guy, George Motz, is like a,
Oh, I know Motz from Mott's Burger. Yeah.
It's like his science lab, and they're always doing new burgers, but they have a couple things, and they have an off menu that makes they have an off menu of homemade white bread. He bakes it in-house with egg salad and tuna.
Oh, that sounds awesome. We're asking the vegan guy if he's ever had burger.
Asking me about
I mean, we should go.
Impossible, right?
Yeah, they have Impossible.
Okay.
Yeah. Let's do it.
As long as I have
Let's go in April when I'm back. Let's hit that for sure.
It is also a problem because it's like, they serve beer.
Oh, I get
And
it.
so like I've gone in there after a dinner and a night out and had another whole dinner.
Yeah, like had a beer and a burger, like an extra 1,200 calories after dinner. Yeah.
I've never not had 2 burgers.
A buddy of mine who is on Zepbound, one of these semaglutides, he described what happens mentally to him is the food noise is turned down in his head. Whereas
That's
my
real.
brain, and I understand this, there's a part of my brain that's just constantly like,
Oh, yeah.
are you getting a little hungry? Okay, start thinking about dinner, lunch, breakfast, whatever. Did you eat enough? Oh my God, this food in front of me is not enough. Oh my God, am I going to need more? And he described that
just
food,
shuts it off.
Yeah, and it shuts it off.
Yeah.
And there's some constipation issues he has, and some he can't eat as much as he used to, which is a good thing.
Yeah.
But he really discussed like the idea of the food noise. He's like, I can actually think more clearly, separate of like my weight loss he may be a guest on the show eventually, but he's lost like 30 pounds, and he is like, but more importantly, like I'm not constantly thinking about food or about my weight. Like it's and that was the most alluring thing for me when he explained that to me. I'm like, man, I do spend like whatever, like when you close that one app in the background on your phone or your computer that's just like making just your shit run, and you're like, oh, now when I close the YouTube, my computer runs better. I feel like if I shut this voice off in my head that's like Burger America Burger, you know?
Oh, yeah. No,
And you know, honestly,
I'm
and
doing it.
and that's been for years, so it's like hard to do just with diet and exercise, and that's why these medications are just like life changing.
And there's some light research into it really helping with addiction.
Oh, like food
Like addiction in general.
In general, okay.
Because it nips like a little bit of the impulse control too.
For sure,
yeah. So a lot of people they're doing some research on that for like helping alcoholics or drug addicts quit and stuff.
I mean, it's good to talk about it with a certified person that way, because I do feel like if there are people out there, you know, like there is there's a stigma, there's a negative stigma to it, where it's like you're only gonna you would only take it for vanity, and you would only take it for almost like a steroid.
Or like a Botox.
Or like a Botox.
Yeah, where it's like it's purely aesthetic, and it's like no, some of these. And maybe
and
someone,
that's what social media has done. You know, it's like just glamorized this kind of, you know, Botox type of.
And I think there's nothing wrong with, especially as you age, which is another thing that I've noticed, is that most people that are. The reason that it's big in our life
is because our friends are 40
Our friends are mid 40s and 50s and 60s and 30s, and they're starting to become overweight.
Yeah, or their weight, which has always been not a big deal, is now a doctor's going, hey your A1C is going up, hey, your blood pressure's up,
and they go, well, how do I fix
it's
that?
less about bikini season and more about like,
more
fuck,
health.
I gotta
health.
And so in a lot of ways, it's like, I think maybe. I mean, obviously society's going to look at things the way they want, but a good way to look at it is like, isn't it a bonus that the thing that fixes our hearts makes us look snatched?
Yeah.
And like,
absolutely.
You know, like, isn't that dope?